Hey guys, it's Kate. Welcome back to my channel. Today I wanted to get back into some more nursing things and I wanted to talk to you about my experience with OB. Now, when I decided to go into nursing school, it was because I wanted to be an OB nurse. So this is a class I've been looking forward to since I started taking prereqs 3 years ago now. So this class was very important to me and I really wanted to enjoy it. Going in for my program, they used to do OB and then pediatrics separately in 2 different semesters, and now they put it together into one class in 6 weeks. So it was very crammed together, and I went into this class very positive and very excited because this is something I want. I want to work with tiny people. I really like the tiny people. I also like the moms, and in OB you get moms and babies, so why not do both, right? So I kind of just want to go over the content with you, how my clinical experience went, and just like my idea of the class for those of you who are going into nursing and don't really know like what to expect with OB. So my OB class, like I said, was only 6 weeks long. I have one more test in it next Tuesday, and then we're done. It's a very short class. For example, this is my binder. This is my binder for OB and Peds. It's only 1 inch, like it's pretty small. So I don't have that much in here, and mostly we went off of a lot of like PowerPoints, and then we had like these big pictures, which I really like when studying. So if you don't have these, I'll put a link down below where I know that the teacher gets all of these from, because she just gave us like 20, 30, 40 of them. But that's how I work Picmonics, kind of like a picture mnemonic. Get it? Picmonic, picture mnemonic. It works together in my brain. So this class started as you would expect an OB class to start, with the baby in utero. And so we talked about things that would cause problems during labor, how to take care of mom. So all the drugs you'd have to go through, like with placenta previa or abrupto placentae. So the placenta's either in the wrong spot or it's come out completely, and that's a harm for mom and baby because that could be hemorrhage, baby's not getting oxygen. It's a big deal. So we talked about some nursing interventions to get us through that, and then we moved on to the assessment of a newborn and how you would make sure that the baby's okay when they come out, the shots that they're going to need to get, all their vaccinations. We didn't memorize the vaccination schedule because in every peds office you ever go to, it's literally on the wall. So why even bother like memorizing all that when, depending on facility and depending on all these other things, there's no reason to memorize it. Just don't do it. So we didn't memorize that. Then we went into a simulation. So at my school we have 2 simulation mannequins. One was a female and she actually gives birth. So we had one simulation where the baby had shoulder dystocia, and that is where the shoulder gets stuck on the pelvis as the baby's trying to get out of there. So it's a little stuck. And then how to get baby out safely. And then we did another one with postpartum hemorrhage. So what to do with mom if she's hemorrhaging. And those were actually really easy simulations. Our instructor was in there with us and she was really cool because she knows that it's not something that we're gonna see every day. And so she's kind of talked us through like, this is what would happen in a normal situation where it's not a mannequin, you're also comforting the patient, you're not just doing all the medications, things like that. So it actually calmed me down pretty well for my actual clinical experience. Now I had my simulation on a Friday and then I went right into clinicals on Monday. So my clinical lasted for 6 hours, from 7 a.m. when they got report until about 1, so like right after lunch. I came into the OB and I could hear a lot of screaming and a lot of running around. And so I knew that there was babies coming out somewhere. And my goal was to be with the baby catcher all day, which I think is kind of fun that the baby nurse is called the baby catcher. They're really not the ones that catch the babies, the doctors do, and then they just hand them off, but we're in charge of, the baby catchers are in charge of the baby from then on out. So when I got in there was actually 3 laboring moms, and one of them was gonna go into a C-section. Now, I've seen vaginal deliveries before, and so I was really interested in the C-section because you don't get to see that often, and then I can also get a chance to see the structures of like the uterus and everything as baby's being born. So we went into the OR, and it was just like a regular OR. I had done my OR rotation last year, and it was just so much more chill. There's the doctor, the NP, the anesthesiologist, mom nurse, and then the baby catcher. And then the charge nurse was also in there because she was going through a spinal, and so the charge nurse is just kind of there watching, making sure everything's okay. And baby came out fine. It was a beautiful little baby girl. And then they passed him off to us, and oh God, I can't cry. So I was just amazed and blown away at how beautiful and perfect this little girl was. And it kind of like hit me then that like, yeah, this is my calling. I really want to help babies, like help the small people. And we got her out and we did all the APGAR scoring at 1 minute and 5 minutes. And then we weighed her. Daddy came over and we put some footprints on him, which was kind of cute. And we just cleaned her up and then put her on mom for skin to skin. And then we're just taking vitals and making sure mom's okay. And I was just amazed like by the whole process. Like everyone was so easy about it, like, oh, a baby's just been born. And I'm like, a baby's just been born right in front of me. And it was amazing and I absolutely loved it. So mom went out to recovery and every half an hour we had to go through and do more vitals, make sure the baby's okay. And doing vitals on a person that's about this big compared to a person that is this big is very different. So for this baby, you have to do, well, for any baby, you have to do the heart rate and respiratory rate. And then just making sure that they're kind of like the right color. Because if they're blue, then something's wrong. But this baby was pink, she was fine. She breastfed really quickly. And I'm trying to do the heart rate, and a fetal heart rate, so when they're in utero, is between 130 and 160. So you expect a baby who's only a couple minutes old to be around the same range. And so you're sitting there listening, and it's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And I kept losing count because I only count for about 30 seconds and then I double it to see their fetal heart rate. And so I'm sitting there holding the stethoscope on baby, watching the clock. And mom is getting kind of worried because I had to keep restarting. So it's like been like 2 minutes that I'm holding the stethoscope on there. And she's like, is there something wrong with my baby? And I was like, no, I just can't count. And so it was a little bit of a problem. Like I'll get better at that. I also kind of messed up like respiratory rate, doing the same thing. I was trying to count really fast because they breathe really fast because their heart's beating really fast. And so I kept forgetting to double it. And so it looked like the baby wasn't breathing well, when in fact, she was breathing just fine. We caught that later though. And then for the rest of the morning, we were just doing paperwork to confirm that this child has now actually been born and is an actual human, and filling out all the birth certificate and everything. And I just thought that was such an amazing process. Like, not just the fact that we delivered a baby, but that we are now establishing that there's a new human on this planet. And I loved it. Now, while we were in there, the other 2 moms had already given birth. And there was, and since we were in there sterile, someone else had to go be baby catchers for them. And so I didn't get to see those 2, but that was fine with me because I got to see how it goes from baby born and then all the steps following to make sure that baby is actually recorded as a human, kind of a deal, and make sure that baby is okay, make sure mom's okay. But that wasn't really our job as baby catcher. We were more just focused on baby. So once baby was born and we had all the paperwork done, there was no other moms laboring. There was like 2 other moms there that had just been induced, which I got to watch, which was actually kind of cool. And they were only at 2 centimeters, so there was not going to be a baby born anytime soon. And I still had about 4 hours left in my clinical. So the baby catcher was actually floating from the Nicu, which we have a level 2 Nicu. And so they have 10 beds and they treat some pretty critically ill babies there. And that's always been fascinating for me, like how NICUs work. So I said, can we go in and just like scurry on through the NICU? She's like, yeah, let's go. So we went over to the NICU. I was going through and I was like talking with some nurses and I was like, why did you choose the NICU? Like, because there was no babies being born, I took as much advantage of this as I could to ask why they chose these specialties. Like, is it something that like I am thinking as well? And so I'm on the same lines. So most of them were like, well, we originally were labor and delivery nurses, or I've always wanted to be here. But then I really got into the pathophysiology and the real challenge with NICU babies, and then just focusing more on baby rather than baby and mom and all these other things. And that really got me thinking. I was like, Yeah, you're right. Like, I really enjoy patho. I really enjoy a disease process. I really enjoy watching how they fix the disease process through medication, intervention, surgery, things like that. And so I started like really thinking about it, and I was like asking other nurses, and then someone told me about a PICU, which is pediatric ICU. And they're like, well, I went from a NICU and then I went to a PICU, and I actually really enjoyed the PICU more because they're older children, so you have a more variety of disease processes. And you also get just a whole nother level of intuition and all these things that can actually help you like on a traditional med-surg adult floor. And I was like, I like that idea. So ever since then, pediatric ICU has kind of been like more at my top now. Like it used to be like OB and then NICU and med-surg and just like other random stuff. But now I'm thinking PICU. Like, I think that's something that I think I feel really good at and like excelling at, kind of a thing. I don't know. And then a lot of other nurses I talked to, they were on other floors and then realized that they needed a change until they went to OB and really enjoyed it. So it wasn't like their first choice, but it became their first choice. So I know that like even though I have a first choice, it might not be what's suited for me, but that's the beauty of nursing, is that you can change and go so many different directions. Like wherever you want to go to nephrology, oncology, PICU, NICU, med-surg, cardiac, whatever you want to do, you can really do it. I know coming right out of nursing school, you can't just go right into a specialty. So I'm probably going to take about a year or two on a general med-surg floor just to kind of get an idea of different disease processes, get into a groove as a nurse, and then really try to work my way into a PICU, a NICU, OB, because I know that's my calling. Like just seeing that baby be born was so refreshing for me, because I was like, nope, this is definitely what I want. Because sometimes I'll be up on the med-surg floor and I'm like, why would I ever want to be here? I don't want to be here. But with babies and small people, I'm helping to nurture and grow and help our next generation, which I think is beautiful. And I really want to be a part of a child's life, and their family too, because a lot of times with pediatrics, it's not just about the kid that's sick, it's their whole family. They're all involved, and I want to help be involved and help them all feel comfortable about it. So coming kind of back to content with everything that we had, the tests were very much on assessing the patient, like what are you going to see, and then patient education, so teaching the family, teaching the patient what's going on, because kids are actually pretty intuitive. They know when something's wrong, and so you just have to be honest with them. And that's a lot of what the tests were like, what do you really do? They're not asking you pathophysiological questions like, if this happens, why does this happen? Or like, what do you expect to happen? It's not really like that. And so I've been really focusing on how to assess a child, because every age is different. You had the Erickson's stages of development, and so you kind of have to go with like what he says, like, oh, don't touch an infant. Like, they are very stranger danger and you're a stranger, so you have to kind of build a rapport with them. As an adult, building a rapport with the nurse is a lot quicker because people understand that nurses are there to help you in most cases. And so it's just things like that. Or teenagers, they don't really like talk about anything in front of their parents, so you just get the parents out of the room and you can get your answers. But I really enjoyed the clinical aspect and the information. I didn't really enjoy the class, but it's purely because my teacher, her teaching style doesn't fit with my learning style, and so I kind of had to teach myself. And sometimes you're going to come across that in school, whether it's nursing or any other kind of degree. You're going to get teachers that teach one way that doesn't really help you learn. And so a lot of like what I've been learning this semester is that you have to be an adult learner. We're all in this program, we're all adults. We have to take advantage of this opportunity and push ourselves to the next level. So I'm reading all the time, I'm rewriting the notes, I'm looking up supplementary information on Khan Academy, a great tool, YouTube, great tool, other books. I have a whole library of books to my disposal between my mom, who took this program 8 years ago, one of my sorority sisters from college from my first degree, gave me all of her books, so then I have a bunch of supplemental books from her. Actually, when I started the nursing program, I had to buy a whole new bookshelf because there is a lot of stuff here. This whole bookshelf, like just by itself, like even all the way down, like, I mean, I have a lot of books, so I have a lot of resources that I can go to if I'm really not getting what I'm supposed to be getting. That's my biggest advice, is use outside tools if you can't get something, because if you can't get it from the content they're providing you, no matter how many times you read that content, you're not gonna get it. So try a different avenue. I'm kinesthetic, audiovisual. So YouTube videos are wonderful for me, especially when people are drawing things out. There's this one guy that draws with a Sharpie, call him Sharpie Man. And he just like draws out the pathophysiology, the disease process, and then interventions and how they all work together. And it's really refreshing. I really enjoy looking at those ones. So that was my experience with OB. I absolutely loved it. Unfortunately, my class didn't get to do a pediatric rotation purely because in my area, a lot of pediatrics is done either at home health or at our pediatric center across the border in Washington. And we just don't go over there that often as students, unfortunately. So I'm really hoping that in 4th semester, when we get to pick a specialty for precepting, I am gonna ask for a PICU, Nicu, at multiple hospitals. I wanna do an ICU at some point, so I'm not gonna give them an option to not let me be in an ICU because I really wanna see what that life is actually like. In our clinicals right now, we don't get to go to ICUs, and so I wanna take advantage of the fact that I can choose that and actually get into the ICU. But yeah, that was my experience in OB. If you are an OB nurse watching this, please comment down below why you chose that profession and why you chose that specialty. I love hearing other opinions and everything. And then if you're a nursing student, what specialty do you want to go into? I would like to hear from that as well, because maybe I'll make a future video on my other rotations that I've done. This is just the one I did right now, and I wanted to talk about it, especially since the class is ending soon. But other than that, hit the like button and subscribe to my channel if you enjoyed this video. Be sure to follow me at Lyrical Fit Chick, where I'll be posting all of my lifestyle events, nursing, fitness, and just other fun things that happen throughout my life. Otherwise, I will see you in the next video. Bye!